Thank you. It's great to be here and to talk to you all today. And so over the next, 10 minutes or so, I'm just going to try to give you a little bit of an overview of where we are from a, viral and infection standpoint. So, as we're all aware, we are well in the middle of another wave of COVID infections, this case caused by the Omicron variant. This has caused, really in many countries throughout the world, but especially in Scotland, has caused a massive spike in cases, such that all the previous waves are sort of small foothills compared to this rise in cases that we've seen with Omicron. And that rise happened very, very fast. And part of the reason for that is because the Omicron variant behaves quite differently from some of the variants we've seen before. Now, we've heard a lot of talk about this Omicron variant and how it's causing these cases, but we've also heard a lot of people talking about how Omicron might be a great thing and that this might, be the lead on to the end of the pandemic or the start of viral endemicity. And so I'm just going to spend a minute here really talking about Omicron and what we know so that you can sort of have a better idea of exactly what that means for the pandemic. So Omicron is a very new variant, but caused this rapid rise in cases in countries around the world. And that is specifically because the variant is extraordinarily good at evading the immune system. So people that have been infected before, whether they've been infected with the original strain, with Alpha variant, with Delta variant, they are getting reinfected with Omicron. We're also seeing that people that have been fully vaccinated, so 2 doses of AstraZeneca, of Pfizer, are getting infected, and that 2 doses of the vaccines offers very little protection against an Omicron infection. Now, thankfully, we are seeing that people that have had a 3rd dose of the vaccine are more protected, but it doesn't get nearly as good as restoring protection as we had to previous variants. So we have a variant that is evading the protections that we've built up. And there's some evidence that it's also a little bit more transmissible. So that is a very bad state on top of having such robust viral transmission that we were seeing with Delta. But what's sort of confusing about Omicron is that Omicron variant has what people are saying lower severity. And that's a really bad interpretation and presentation of what the virus is actually doing in causing disease. But there is a change in how Omicron causes disease compared to Delta variant. And that's because Omicron seems like it grows better in the upper respiratory tract, in people's nose and throats, whereas Delta variant and others grew better in people's lungs. So it's thought that Omicron might cause slightly less severe disease, but this is the way COVID is being presented and talked about in the media and in, political debates so often, is severity is being defined as, is somebody hospitalized or not? That is the cutoff. But that ignores a tremendous amount of disease that is being caused not only by Omicron variant, but by COVID variants before, because you can have an incredibly severe infection that lasts a very long time, and that's not counted as a severe infection because you didn't wind up in the hospital. Likewise, you can have a protracted infection, or you can have an infection where the symptoms just don't resolve, where you develop long COVID and symptoms can last months to years. And that's not counted as a severe infection because you're not hospitalized during acute COVID. And yet those are incredibly severe infections that have a very large toll. I'm presenting this and, a little bit short of breath while I'm presenting this, and pleased to be able to sort of sit upright here because I was infected with Omicron variant about 4 weeks ago. And this has been 4 weeks of barely been able to work, being incredibly short of breath, being, having difficulty walking, having any energy to do anything, having, respiratory issues, having brain fog, a wide collection of symptoms for 4 weeks. And I can tell you, there is absolutely nothing that is mild about this variant. And looking into the future, this has been 4 weeks. How long is this going to last? I don't know. We know that between 1 in 7 and 1 in 10 people that get acute COVID have symptoms that don't resolve within 2 months. So are these symptoms going to continue? I don't know. But again, all of this is being talked about as mild. But this is taking an incredible toll on me and on so many people here. So we just need to keep that in mind when we're thinking about how this is being talked about. When we're talking about letting people get infected because it's mild, it's not. And this is happening to adults. This is happening to children. This is happening to people that have been vaccinated. This has been happening to people that have been infected. Even people that have had long COVID are getting reinfected and developing worse conditions. So this is going to take a tremendous toll. And so when we're talking about a virus becoming endemic, when we're talking about Omicron being a good thing, this is not based in what the virus is actually doing, because it's not mild. And we can't afford to let this disease happen to everybody in the population. But even if it did, even if everybody in Scotland got Omicron and developed immunity to Omicron, well, how long would that even last? We are already seeing, in Scotland, we've seen a peak of cases and it's starting to go down now. We saw the same thing in the UK, which was part of the decision to start releasing all the measures. But unfortunately, now we are seeing an uptick in cases again. We're hearing about the BA2 variant of Omicron. And there's even talk that BA2 variant of Omicron might be able to reinfect people that have already been infected with Omicron. Now, that might not be true, but whether it's this variant or the next variant, the virus is going to keep evolving as long as we keep having infections around the world. And unless we actually look globally, unless we try to stop infections globally or take stronger measures locally, we are going to keep having wave after wave of infections. And they are not going to be mild. And there is no reason to think that the next variant is going to behave the way this variant has. Viruses don't automatically become less severe over time. And if population immunity doesn't hold up, as it doesn't for SARS-CoV-2, we are going to be experiencing this again and again, as we have. And so this is why I am, and so many people here are so focused on what communities can do and what individuals can do to protect themselves, because the governments are not doing what's needed to protect the population from what is an incredibly severe disease. So there is some cases for optimism here. We do know that people with boosters are better protected against Omicron. We have new vaccines coming down the line. We know a lot more about the virus. We're making progress in understanding long COVID. But until we take real effort to stop transmission of the virus through a combination of vaccines, masks, distancing, testing, we are going to continue facing the same situation that we've been in. And that is going to continue to have very severe effects on people's health and well-being, not just now, but when you think about potential long-term implications of people with long COVID. The ONS already estimates that over 2% of the entire UK population is suffering from long COVID. The long-term impact on people's health, the long-term economic impact, the long-term on the NHS is incredible. So there's a lot we can do. There's a lot we can do individually, and there's a lot we can do as a community and as a country. It's just so important that we do continue to act.